Is your healthcare data a ticking time bomb? Are you losing sleep over the fear of a massive breach, a compliance catastrophe, or just how inefficiently your data moves? You're definitely not alone. The healthcare industry is a hot target, and when data is mismanaged, the fallout is devastating. But what if I told you there are proven secrets out there, battle-tested best practices from other organizations that can turn these data nightmares into a smooth, secure, and efficient operation? And what if getting them in place was easier than you think? Stick around, because we're about to sort out your healthcare data headaches. The horrors of healthcare data mismanagement. Let's be blunt. Healthcare data is a minefield. We're talking about incredibly sensitive patient information, data that's critical to people's lives. If it's compromised or messed up, the consequences can be truly dire. In 2024, the average cost of a healthcare data breach hit a jaw-dropping $9.77 million. And for the 14th year straight, healthcare data breaches are the most expensive ones out there, across all industries. Think about that. A decade and a half of being the priciest sector for data screw-ups. This isn't just about the cash. It's about losing patient trust, facing crippling disruptions to your operations, and getting hit with serious legal and regulatory fines. In 2023, over 133 million patient records were affected by data breaches reported to the HHS Office for Civil Rights. And the start of 2024 and 2025 hasn't slowed things down. For example, April 2024 saw over 15 million individuals' records compromised in reported breaches. Preliminary reports for April 2025. Over 12 million individuals affected in that month alone. The sheer number of records is mind-boggling. Take the Change Healthcare attack in early 2024. It was confirmed that data theft there could affect as many as 1/3 of everyone in the US. So, why is healthcare such a magnet for this? Well, the data itself is gold on the black market. Complete medical records can fetch up to $1,000, way more than your credit card details. But it's not just cyber criminals. The sheer complexity of healthcare systems, often a jumble of old and new tech, creates weak spots. And while new digital tools like EHRs, telemedicine, and IoT devices are great, they also give attackers more doors to try. Then you've got shadow IT. That's when employees use apps and services that IT hasn't approved. It creates huge blind spots. 1 in 3 data breaches in 2024 involved this shadow data just floating around outside of IT's control. If you don't know where your data is, how can you protect it? And a scary number of organizations, some say 60%, don't even include shadow IT when they think about threats. Employees often grab these tools to get work done faster. About 80% use shadow IT because it's convenient. And let's not forget interoperability, or the lack of it. Getting different systems to actually share data smoothly is still a massive challenge. This doesn't just make things complicated. It can delay care, mess up information exchange, and directly harm patient outcomes. It's more than an annoyance. It's a real roadblock to good, modern healthcare. The human factor? It's huge in breaches, playing a part in as many as 74% of them. Stolen or compromised login details are a major problem, involved in a ton of breaches. In fact, cyber attacks using these stolen credentials jumped 71% year over year recently, and a whopping 82% of data breaches involve data stored in the cloud, which just shows how vital good cloud security is. The fallout isn't just financial or bad for your reputation. Cyber attacks can stop patient care in its tracks, lead to medical problems, and in the worst-case scenarios, have even been linked to higher death rates. That's the real nightmare. When mismanaging data directly puts patients and their lives at risk, the pressure is on, and the old ways of handling data just don't cut it anymore. The blueprint for bulletproof data sharing. All right, enough of the scary stuff. The challenges are big, no doubt, but they're not impossible to overcome. There are healthcare organizations out there, the forward thinkers, who figured this out. They've stopped just putting out fires and have instead built solid strategies, best practices that give us a blueprint for sharing data securely, efficiently, and in a way that ticks all the compliance boxes. These aren't just vague ideas, they're real, actionable steps you can borrow and use in your own organization. We're talking about a full-circle approach that mixes smart planning, the latest tech, and a deep-rooted culture of security. It's about building a tough data ecosystem from the very start. What's the main idea? Stop waiting for problems to happen. Start preventing them. It's about weaving security and smart governance right into how you share data. And the good news, the road to get there is clearer than you might think. So, what are these organizational secrets? They really come down to a few key best practices that all work together. Smart planning for data integration. This is ground zero. You can't build a solid house on a wobbly foundation. Figure out your goals and what you need. What do you actually want to achieve by integrating your data? Is it connecting different EHR systems, making it easy to join a health information exchange, HIE, getting better insights for population health? Your goals shape your strategy. Really dig into what you need to pinpoint the exact problems and chances for improvement. Get everyone involved. Data integration isn't just an IT thing. It changes the whole organization. You have to bring everyone to the table right from the start. Doctors, nurses, admins, IT folks, compliance officers, even patient reps. Getting their support and ideas is key to making it work. Put your resources in. Let's be real. Good data integration and security need proper resources. That means money, the right people, with the right skills, and enough time. Cutting corners here will bite you back hard down the line. Healthcare organizations are planning to spend more on cybersecurity. Some surveys say 55% expect their budgets to go up. Globally, cybersecurity spending is set for a big jump. Really know your data and how to govern it. You can't manage what you don't truly understand. Full data inventory and classification. Get to know your data. Understand exactly what you have, where it all lives, including those sneaky shadow IT spots, who's in charge of it, who needs to use it, and how sensitive it is. Sort your data so you can put the right security measures on the right things. It's genuinely shocking how many places have incomplete or old data lists. Solid data governance plan. Set up clear rules, steps, and who's responsible for what when it comes to managing data. This means standards for data quality, how data is handled from start to finish, and regular checks. Good governance makes sure your data is accurate, consistent, and used the right way. Jump on modern tech and standards. Hello, FHIR. Technology is a game changer, and in healthcare, Fast Healthcare Interoperability Resources, FHIR, is a standard from HL7 that lays out how healthcare info can be passed between different computer systems. It uses modern web tools like RESTful APIs, JSON, and XML, which makes it much simpler for developers than the older standards. FHIR breaks data down into small, easy-to-handle resources like a patient's record, a medicine, or a test result. Cloud-native setups and APIs. Go for cloud-based solutions. Cloud platforms give you room to grow, flexibility, and often top-notch security. APIs, application programming interfaces, especially FHIR APIs, are the highways for modern data sharing, letting you get real-time data from all sorts of places. The market for healthcare interoperability tools is booming thanks to tech like this. FHIR training. Get your development teams trained up on how to use FHIR properly. This widely used protocol is crucial for tying together different systems. FHIR use is growing fast, with estimates saying most health systems around the world will have FHIR APIs built in very soon. Some surveys show 84% of healthcare leaders expect FHIR use to keep growing. Lock down your data and stay compliant. This one's a deal breaker. Full-on security measures. You need security in layers, strong ways to control access, multi-factor authentication, encryption for data moving and data sitting still, regular checks for weak spots, penetration testing, and solid plans for when things go wrong. Remember, a huge chunk of breaches happen because of stolen login details. Compliance from the get-go. Build compliance rules, HIPAA, high-tech, GDPR, etc. into your systems and processes right from the start. Don't tack compliance on as an afterthought. The cost of not complying on top of breach costs can be massive. Who gets access and the need to know. Rule: make sure people only get access to the data they absolutely have to see to do their jobs. This is called the principle of least privilege. Put strong identity and access management (IAM) systems in place. Check your vendors. Your data is only as safe as your weakest link, and often that's a third-party vendor. A staggering 98% of organizations have at least one third-party vendor that's had a data breach. So you need a strict program for managing vendor risk. Use analytics to learn and get better. Data's only useful if you can do something with it. Link data to analytics tools. Make sure your data sharing setup can easily connect to your analytics tools. This lets you pull out insights for better medical decisions, smoother operations, managing population health, and research. Secure and expandable connections. As you connect more and more data sources, make sure these connections are secure and can handle more data as you grow. When you put all these best practices together, they create a really strong defense against those data nightmares and give you a launch pad for data-driven healthcare breakthroughs, making implementation a breeze. Fusion and Eris. Now, you might be sitting there thinking, this all sounds fantastic, but actually, doing all this seems like a huge mountain to climb. And you know what? Traditionally, it often has been. Tying together different systems, making sure everything's super secure, staying compliant, and getting true interoperability. It can be complicated, take a lot of time, and cost a fortune. This is exactly where Fusion and Eris step in. We built it from scratch to embody all these best practices and to make putting them in place not just doable, but genuinely straightforward. Think of Fusion as the smart engine driving your secure and efficient data exchange. Here's how. FHIR native, Fusion is built on FHIR. It's not just an add-on, it's at the very heart of how it's designed. This means it works right out of the box with other FHIR-compliant systems. We take the headaches out of FHIR implementation, letting you connect your old legacy systems and new modern apps without a fuss. You get a flexible setup and can grab data whenever you need it through RESTful APIs, which takes a load off your IT teams. And because FHIR uses common web standards, it means easier development and your apps will work across different platforms. Simplified integration and one patient record. Sick of data being stuck in different silos? Fusion is a champ at pulling data from all sorts of places, EHRs, labs, imaging systems, wearables, you name it, into one unified view, which you can access on Eris. We give you the tools to create a single, complete personal patient health record. This gives doctors and nurses the full picture they need to make smart decisions and coordinate care much better. Security and compliance, built in. We're as serious about security as you are. Fusion and Eris both have robust security features baked right in, all lined up with healthcare's tough requirements. This includes advanced encryption, really specific access controls, audit trails, and tools to help you meet HIPAA, high-tech, and other regulations. We help you organize who gets access to what data efficiently and securely. Faster analytics and insights. Really tap into what your data can tell you. Eris makes sure your integrated data is ready to go and easy to connect to the analytics tools you like to use. This means quicker insights, better reports, and the power to really use your data to get ahead. Saves you money. Building custom connections and managing lots of complex point-to-point setups can get incredibly expensive. FHIR itself is often cheaper than older standards or building everything from scratch. Fusion smooths out the whole process, cutting down on development time, maintenance costs, and the risk of expensive mistakes or breaches. That average cost of a data breach is a pretty stark reminder of why getting this right is so important financially. Imagine connecting a new data source in just days, not months. Imagine having a clear, checkable record of all your data exchanges. Imagine knowing your patient data is protected by top-tier security, so you can focus on innovating and taking care of patients. That's what Fusion and Eris make possible. We've definitely covered a lot. We've looked right into the chaos of healthcare data nightmares, those crippling breach costs, the constant attacks, the tangles of trying to get systems to talk to each other, and that ever-present threat to patient safety. But more importantly, we've lit up the path forward. We've pulled back the curtain on those organizational secrets, the vital best practices in smart planning, data governance, using modern tech like FHIR, strong security, and integrating analytics that can completely change how you handle data exchange. And we've shown you how Fusion and Eris aren't just another bit of software. It's a complete solution designed to make putting these best practices into action straightforward and effective, turning those bad dreams into a secure, efficient, and compliant reality. Ready to stop just dreaming about better data exchange and actually start building it? Pop over to our website to get a deeper look at what Fusion and Eris can do and check out some detailed case studies. The link's right there in the description below. You can go for the bundle or choose either, depending on what you need. Ask for a personalized demo. Let us show you exactly how Fusion and Eris can tackle your specific challenges and help you roll out these best practices without the usual headaches. Download our free white paper, The Definitive Guide to Bulletproof Healthcare Data Exchange. It goes into more detail on the strategies we talked about today and even includes a checklist you can use. And of course, if this was helpful, please subscribe to our channel and hit that notification bell so you don't miss out on more tips for transforming healthcare data management. What's your biggest healthcare data nightmare? Drop it in the comments below. Let's get a conversation going. The days of dealing with fragmented, insecure, and clunky healthcare data exchange are numbered. The tools, the standards like FHIR, and the organizational best practices, they're all here. By taking a proactive, strategic approach and using solutions built for the real complexities of modern healthcare, you can protect your patients, your organization, and your own peace of mind. Don't let data nightmares hold you back any longer. It's time to build a future where healthcare data empowers, heals, and drives innovation safely and efficiently. Thanks for watching.